Hello dear friends, welcome back. My dear friends, if you are watching this video for the first time, I have a request that please go and watch the lectures regarding the femur bone, right? We have already discussed. We have discussed the upper end of the femur. Then we discussed about the shaft. We have divided the shaft into three regions, the upper 1/3, the middle 1/3, and now we will discuss the lower 1/3. Right friends, the markings of the lower 1/3. Friends, I will give the links of all those videos in the description. If you are watching us for the first time, go and watch those lectures, and if you like the lectures, please subscribe our channel and please share these videos with your friends also. So let us begin the lecture about the lower 1/3 of the femur bone. So the lower 1/3 of the shaft of the femur bone has four borders and four surfaces. Let me write here lower 1/3. Right friends, I have introduced already this bone. This is upper 1/3, middle 1/3 and lower 1/3. The upper and middle have been already discussed. Now let us see about the lower 1/3. Lower 1/3. Lower 1/3 has borders and it has, my dear friends, surfaces. So that's great. How many borders, how many surfaces? There are four borders and four surfaces. And what are those borders? How many borders? Four borders. 1, 2, 3 and 4. So what are those? Those are the lateral border, the medial border. I will show you in the lecture in the bone. Then there is the lateral or medial supracondylar line. I will show there. There is the lateral supracondylar line, and then there is the medial supracondylar line. So these are the four borders. You just write it down here. This is the theory. Then we will apply this theory on this bone in the next video. So let us fastly see it. This is the lateral side. So this is the lateral border. Then this is the medial side. This is the medial border. And then posteriorly there are two lines which are created by this linea aspera. The linea aspera, when it comes downward towards the lower 1/3, it gives a lateral line and a medial line. And both of these lines are present superior to these condyles. That's why we say that these are the supracondylar lines. So one is present medially and one is present laterally. So we say these two lines makes borders. So lateral supracondylar line, medial supracondylar line. So how many borders? Four borders. The lateral border, the medial border, the lateral supracondylar line and the medial supracondylar line. And how many surfaces it has? So it has four surfaces. And what are those surfaces? Let's firstly see. First, this is the anterior surface. This is the lateral surface, this is the medial surface, and this is the posterior surface, or it is called the patellar surface. So let me write here first here, then we will go for the practical video of this lower 1/3. So there is the lateral surface, there is the medial surface, there is the anterior surface, and then there is the posterior surface, or this posterior surface is also known as the patellar surface. This anterior surface is also known as the patellar surface, and this posterior surface is also known as the popliteal surface. Popliteal surface and patellar surfaces, right? So let us see this lower 1/3 of this shaft of the femur bone and this practical video regarding the anatomy of the femur bone. So see you there.